Today we are going to talk about ophthalmic nerve and its branches. I mean lacrimal nerve, frontal nerve, and very important nerve which is nasociliary nerve, right? Now let me draw the diagram from this aspect. I'm going to show you the orbit, right? And along with that I will show you the cavernous sinus and floor of the middle canal fossa. Now let's suppose here it is anterior canal fossa, here it is middle canal fossa, right? And here is orbit. I'm showing here the back of the orbit, right? This is optic canal. What structures pass through optic canal? Optic nerve and ophthalmic artery, right? And here is, yes, superior orbital fissure, right? Here is your orbit. Now, posterior to the orbit, there is cavernous sinus. So let me draw cavernous sinus over here, right? Here it is cavernous sinus, and there is special focus on its lateral wall, right? This is right cavernous sinus, right? This is its lateral wall. This is the roof of the cavernous sinus. This is its medial wall and floor, right? And of course here is what? Middle cranial fossa, right? Here is foramen rotundum, very good, foramen rotundum, and here should be foramen ovale, excellent. Now, as you know that ophthalmic nerve is one of the branch of the trigeminal system. It actually originates from trigeminal ganglion. Now trigeminal ganglion is present on the tip of the petrous part of temporal bone in a small depression, right? I will draw it here. This is trigeminal ganglion. This is trigeminal ganglion, right? Now trigeminal ganglion is basically a sensory ganglion, and its central fibers are going to the pons, right? And these peripheral processes, right, these are making three bundles which are called three nerves. Number one, this is your ophthalmic. This is which one? Ophthalmic. Other is maxillary, and the third one is mandibular. Third one is mandibular. As you know, mandibular division will pass through foramen ovale and go inferiorly and appear into infratemporal fossa. It will appear into infratemporal fossa. So this is your mandibular division, maxillary division, right, and ophthalmic division. Now ophthalmic division and maxillary division, as they originate from this trigeminal ganglion, they move forward into the lateral wall of cavernous sinus, right? So they will pass through cavernous sinus, right? This is your which nerve? Ophthalmic. And here it is maxillary nerve, right? Now I will go later on ophthalmic. Maxillary nerve, when it will emerge from anterior aspect of the cavernous sinus, it will jump through what is this? Foramen rotundum and go into not infratemporal fossa, pterygopalatine fossa. This is pterygopalatine fossa. This is the mandibular nerve which passes through the foramen ovale, and appears into infratemporal fossa. Maxillary nerve passes through the lowermost part of the lateral wall of cavernous sinus, and from its interior aspect it moves forward, passes through foramen tendum, and then it enters into pterygopalatine fossa. I will not discuss these two anymore at this very moment, right? Because these two will be discussed later into detail in other lectures. Today we are going to talk about ophthalmic nerve. Ophthalmic nerve, while it is passing through the lateral wall of cavernous sinus, right, it is inferior to the, yes, fourth cranial nerve and third cranial nerve. It means that fourth and third cranial nerve are also passing through lateral wall of the cavernous sinus. We can say in the lateral wall of the cavernous sinus, ophthalmic nerve is below the third and fourth cranial nerve and above the maxillary nerve. And there is one very important nerve which is in the cavity, and this is sixth nerve or abducent nerve. Abducent nerve is not passing through the lateral wall. Abducent nerve is not passing through the lateral wall. Abducent nerve is passing through the cavity. So we can see ophthalmic nerve has maxillary nerve below it within the lateral wall of cavernous sinus. It has trochlear nerve above it within the lateral wall of cavernous sinus, and on medial side it has the content of the cavernous sinus, including what is here? What is this? Abducent nerve, and internal carotid artery is also there, as you know that it passes through and eventually emerges from the top of the cavernous sinus. Now, let's follow the ophthalmic nerve. Ophthalmic nerve, just before leaving the cavernous sinus, it divides into three branches, right? So, I will show you now three branches of ophthalmic nerve. There is medial one, a little more lateral, and most lateral. Now, ophthalmic nerve has been divided into how many branches? Three branches, right? And these three branches enter into orbit through the superior orbital fissure, right? These are supposed to, what are these three branches? Lateralmost, this is, yes, lacrimal nerve. The middle one here is frontal nerve, very good. And medial most is nasociliary nerve. Now these three nerves, right? These three nerves, they from the cavernous sinus, they have to enter into orbit, or we can say from the middle cranial fossa, they are going to enter into orbit. Lacrimal nerve, yes. Other is frontal nerve, and here it is nasociliary nerve. Now it is very important to understand that exactly in which part of superior orbital fissure these nerves pass through. Superior orbital fissure. Now I will show the orbit from inside, as if you are looking from front, my right orbit, right? Here. These are the supraorbital margin of the orbit. This is the medial margin, this is inferior margin, and this is the lateral margin, right? Let me make it more dark. So what is this margin? And this is medial, and here it is inferior margin, and now we are, this is lateral margin, and this orbit is right orbit or left orbit? Right orbit. Here I can show this is the, yes, here it is nose, nasal cavity crista, gali. There should be another orbit here. You understand? This is one orbit, right orbit, and this is the nasal cavity roughly, and here should be the other orbit, right? Now, in the orbit, this deep structure is the apex of the orbit, the deepest part of the orbit, the posterior most part of the orbit. And then, what is this wall? Medial wall. This is roof. This is lateral wall, and this is floor. Is that right? Again, now you'll repeat. I want everyone is well oriented. Yes, what is this part of the orbit? Floor. What is this? Lateral wall and medial wall. Right? Now, there is a structure, fibrous structure, which is called common tendinous ring at the apex from where extraocular muscles take origin. Right? So, I will draw the common tendinous ring. This is common tendinous ring, which can be seen from within the orbit on its posterior most part. And from here, the muscles are taking origin. Especially, I will show here a muscle which is taking origin. And yes, what is this muscle? Which rectus is this? Yes, it is medial rectus. And here there is a muscle. Yes. Yes, what is this? Lateral rectus. Right? Now, let me show you the origin of lateral rectus. Actually, it is from here. Lateral rectus, right? Any question up to this? And of course, from here there should be origin of superior rectus, and here there should be origin of inferior rectus. Right? Now, why I draw these structures? Because I want you to be very, very clear that from which points these nerves enter into orbit. Right? This part of the superior orbital fissure is within the common tendinous ring, but this part of the superior orbital fissure is above or outside the common tendinous ring. Is that right? Now, keep in view this diagram, which is from the front, and also this from the side. If we look at this diagram, now we are looking at the orbit apex from the back, or we are looking at the superior orbital fissure from posterior aspect. Common tendinous ring is inside, right? But I will just demarcate its margins. Is that right? Now, first of all, lacrimal nerve. Lacrimal nerve enters, yes, it is entering outside the common tendinous ring or within? Outside. It is entering outside the common tendinous ring, right, through the superior orbital fissure. Then we come to what is this? Frontal nerve, right? This also enters. Yes, what is this? Outside the common tendinous ring. But the point which you need to know that common, what is this? Nasociliary branch, this enters, yes, through the tendinous part. Is it clear? Yes. Now if we come over here in this diagram, from here what will emerge? What is emerging from here? Lacrimal nerve. And what is emerging from here? Yes? Frontal nerve. Right? And another thing. This fourth nerve is trochlear. It will cross over here and this will, this is going in wrong direction. It will also pass from outer part. It will also pass through the superior orbital fissure, right, but outside the tendinous ring. So it means there will be another structure here. What is this? Trochlear nerve. Is that right? Yes. Or I will draw it again to make it more clear that, yes. Now you will tell me, okay? Now it's your turn. First, look at the fissure from the back. Lateralmost nerve is lacrimal, then frontal, and then trochlear, right? In the same sequence. Lateralmost, lacrimal nerve. Then there is frontal nerve, and then there is trochlear nerve. So you just remember, yes, very good. LFTs function test. Lacrimal, frontal, and trochlear. Any question up to this? There's no. Now we are left with one. You know, from here, this is oculomotor nerve. It is also supposed to enter into orbit, and here it was nasociliary. Now, oculomotor nerve, if you follow here, we have already seen that nasociliary has gone through the ring, right? Oculomotor, as it come out, it is already divided into upper and lower division, and upper division enters here above the nasociliary, and lower division enters here below the nasociliary. Is that right? And when these nerves will emerge here, what you will find? That, yes, what will be? Upper division of oculomotor will be up, lower division of oculomotor will be below, and in between them, what will be entering there? Nasociliary, right? So again, let me make it more clearly. Upper division of oculomotor, lower division of oculomotor, and in between them there is nasociliary. And then you don't forget your, what is this? Abducent. It has also to enter through there. So it will be in lateralmost part here, and it will appear abducent here. And why it is appearing here? Because it is going to the lateral rectus. Supply the lateral rectus, so it has to be lateralmost. But what is relevant with our today's lecture? Today's lecture is, I will recap all the structures what I have discussed up to now. That basically ophthalmic nerve is one of the branch taking origin from the trigeminal ganglion, right? It originates from the ganglion and enter into lateral wall of the cavernous sinus, right? Where it moves forward, it is below the third and fourth cranial nerve and above the maxillary nerve. But all these structures, third, fourth, cranial nerve, oculomotor, trochlear, ophthalmic, and maxillary, all of them are traversing not through the cavity of the cavernous sinus, all of them are traversing through the lateral wall of cavernous sinus. Meanwhile, sixth cranial nerve is passing through the cavity of the cavernous sinus. Is that right? As I mentioned in some previous lecture. Sixth nerve. Six is sexy. It loves to go through cavity. None of them is sexy. They are all going through the wall. Right? Okay, now, once we bring all the nerves up to the front, from here they have to emerge out. Now, once they emerge out of the cavernous sinus, maxillary nerve through the foramen rotundum goes to pterygopalatine fossa. Now we are left with the remaining nerve. Which nerve? Third, fourth, and ophthalmic and the sixth nerve. All of them need to enter into orbit, but they will go through superior orbital fissure. As I told you, superior orbital fissure has two parts. One part of the superior orbital fissure is inside the common tendinous ring, other is outside the common tendinous ring. Now, from here we see that this ophthalmic, what was this nerve? Ophthalmic nerve, when it emerges outside, it has already divided into branches, 3 branches: lacrimal nerve, lateral most, then frontal nerve and nasociliary nerve. Now, lacrimal nerve and frontal nerve, they pass and enter into orbit through the lateral most part of superior orbital fissure, which is outside the common tendinous ring, along with which nerve? Trochlear nerve, LFTs. So if we see from the front, now we are looking from inside of the orbit. What is this nerve coming in? This one and this one, trochlear. Now we are left with remaining, right? Remaining, what we look at, this is the third cranial nerve divided into upper division and lower division. And what is this? Nasociliary. It enters into orbit through the superior orbital fissure within the common tendinous ring, and it is present between the upper and lower division of oculomotor. So here we can see, this is which division of oculomotor? Upper, this is lower, and this is nasociliary. And lateral to it, it has abducent nerve which was coming through the cavity of cavernous sinus. All others are coming through the wall of the cavernous sinus. Any question up to this? Yes.
So what is the relation of oblique muscle with these nerves?
Once we come into detail, we'll talk about it, right? Okay. He wants to know that what is the relationship of oblique muscle. I don't know he's talking about superior oblique or inferior oblique. I hope he's talking about superior oblique. We'll especially talk about that when we are talking about the nasociliary nerve. Once you have reached here, now we'll take one by one every branch and take it to its final destination, right? First of all, lacrimal nerve. Now what is this wall? Lateral wall. Lacrimal nerve emerges, enters into orbit and moves towards the lateral wall. Just moves towards the lateral wall, and it is, yes, moving anteriorly. This is the outer side, but above the upper margin of lateral rectus. Above the upper border of the lateral rectus, what is this? Lacrimal nerve, which, right, moving forward and laterally, and as it is moving forward, here it will find a gland. And what is this gland? Gland. Yes, it is all the time weeping. Lacrimal gland. So why it weeps? Because lacrimal nerve is going to pierce through it, through and through. It's piercing through it, and eventually it will appear, yes, pass through it, and then it will appear. Here is, you remember, orbital septum, right? It will pass through the orbital septum and then give, yes, supply. This is, if there is upper eyelid here and lower eyelid here. Upper eyelid, lateral most part. So it supplies to a part of the skin of the upper eyelid in lateral most part, and underlying conjunctiva also. And underlying conjunctiva also. Is that right? Now, let me draw another diagram here. This happens to be the front of your beautiful face. And here are your two beautiful eyes, a little asymmetric, I don't know why. And your super nose. Okay. Actually, this nerve, where it will appear? Exactly here and here. Is it clear? Yes. So this is the terminal branch of lacrimal nerve, which is basically palpebral branch, right? And it supplies upper outer part of the eyelid and also underlying conjunctiva. Is it clear? But here is very important thing. You remember, what is this nerve passing through here? Maxillary nerve. Maxillary nerve gives a branch here, which is called zygomatic nerve, and passes through inferior orbital fissure. And this zygomatic nerve, as it is passing, it gives inside the orbit along with the lateral wall. This is the lateral wall of orbit, right? Here it exits out through zygomatico-facial, and here it is zygomatico-temporal. And here was, now you look at it. Yes, my friends. What was this? Lacrimal nerve passing through your weeping gland. Is that right? Clear? Supplying to the skin and conjunctiva. Both. Is it clear? Yes. Why I draw this diagram? From, you remember there is a gland here, pterygopalatine ganglion, right? From the pterygopalatine ganglion, post-ganglionic parasympathetic fibers, which fibers? Post-ganglionic parasympathetic fibers go to, what is this? Maxillary nerve, then zygomatic branch, and then zygomatico-temporal branch. This is zygomatico-facial and this is zygomatico-temporal. From here, as a communicating branch to the lacrimal nerve, and here the parasympathetic fibers reach the lacrimal gland, the secretomotor fibers. Is it clear? In that diagram, how can we show? Yes, we can show that first of all, zygomatico-facial foramen and zygomatico-temporal foramen, both of them are in the lateral wall of the orbit, right? And yes, this was coming here and this will go out. What is this? Zygomatico-facial and other zygomatico-temporal, and you remember this was the communication, if you see from within, plastered against the lateral wall. Any question? Really no question? Yes, okay. So these were important points related with which nerve? Lacrimal nerve, right? The lateral most and smallest branch of ophthalmic nerve. Now we come to the second. What is this branch?